In 2011, I was diagnosed with venous thoracic outlet syndrome, and I had to undergo a first rib resection and then about a year-long recovery. And it was on my right side, so I have a big scar here from them removing my first rib. And then after that process, I kind of had some persistent pain on and off. It wasn't, it was kind of that chronic injury that would just acutely flare up. And things are going really well right now, let's say. So after the first year, things got gradually better. I got stronger, and then I moved out to Colorado, and this is 4 years ago now, and I took on a new activity that involved new workout that involved more overhead training, specifically doing a lot of handstand type movements. And so I was in this position overhead with my arms extended, my wrists extended, and I began experiencing some symptoms that reminded me of my venous, the blood clot that I had when I had thoracic outlet syndrome. So I'm having these symptoms that are similar to the blood clot. At the same time, I happen to be treating someone who has a medial elbow blood clot. Now, it's a completely different situation than what I experienced with mine. Hers was not due to the thoracic outlet region, but I had familiarity with it. It just so happens that the pain that I was experiencing at that time from starting the new activity was right on the inside of my elbow now, and it reminded me of, first of all, it reminded me of my own TOS experience, and then secondly, it reminded me of this person that I was seeing, this woman who came in with a blood clot on the inside of her elbow. And so I pretty much go on high alert. My system is in high protection mode because all of a sudden everything is leading me towards believing that I have a blood clot. So I'm doing research. I'm thinking irrationally at this point that I have a blood clot again because I have these symptoms. I'm working with someone. And I think it's just a great story that pain is both a sensory and emotional experience. So in this instance, there was so much emotion driving everything that I was experiencing that I couldn't even really think rationally for that day or two. I called my old PT that I used to work with, and he was like, "Hey Jim, what's the reoccurrence of blood clots after a VTOS?" And it's very minimal. So I had his reassurance. I stopped doing the activity that was provoking the symptoms, and so that was a huge step. So I took 4 days off from that. Things gradually got better. A week later, I felt almost the same. So why do I tell that story? Well, we are really deep into the understanding of pain science right now, and everything that we do is kind of comparing or this battle against the biomechanical approaches towards physical therapy treatment versus kind of the pain science approach. And the way I look at it is that we should be incorporating these principles of pain science into every patient. Now, why is that so difficult? Well, it's so hard to incorporate, I think, for the average person, especially the new clinician, to incorporate these principles of pain science because they are a little bit more abstract and maybe they're a little bit more out of the field from what we learn in physical therapy school. So if you think about it, if someone comes in and they have shoulder pain, a standard treatment protocol would be a lot of scapular strengthening, engaging the lower trap, the middle trap, the serratus anterior. So it's kind of like shoulder pain, acute shoulder pain equals low trap strength. This is kind of how you could look at it. Now it's more complex with that persistent or chronic pain person because now maybe that lower trap does need to be strengthened, but we also know that a lot of things have happened on the cortical level that are really affecting or impairing kind of the overall presentation. So no longer does strengthening the lower trap really help resolve their symptoms, or does it put their shoulder in a better position, or not that ever works, but the purpose of that is when we talk about the application of pain science in the clinic, things that we always say are, oh yes, you need to be more mindful, you need to have better sleep, better nutrition. Those three are huge. We need to address the biopsychosocial aspects of pain. But with mindfulness, okay, so we tell a person that they need to be more mindful. What does that actually look like? Well, for me, what mindfulness looks like is using some of my manual therapy treatments. I'll actually have them kind of during session be mindful of where their pain is coming from. So something I always ask is, what do you feel right now? Because when you have feeling towards that thing, you bring some sort of context around what the pain is. And when you bring context around it, then they can start relating it to other aspects of their life, and they can start bringing back that feeling into other areas of their life. So one thing I do for mindfulness with my manual therapy is always ask, what are you feeling right now? Other things that I'll do for mindfulness is I'll help people incorporate or be more mindful, strategies to incorporate this stuff of mindfulness in their daily activities. So if someone is sitting for 6 hours a day, it's not that sitting is bad, but it's more of the lack of movement that they're having that is the reason that is kind of contributing towards their symptoms. So they're developing kind of this lack of tissue tolerance, and they're being in these prolonged activities without movement, without blood flow, that's then kind of allowing this painful mindset to set in. So that's something else I'll do for mindfulness. And then also, if the person is more self-aware and they can actually do some seated meditation, I think that's a great route to go too. With sleep and nutrition, I have a few go-to websites and resources that I use, but I try to keep it pretty general. And then again, from the mindfulness perspective, I will often just ask the general questions just to make them more aware about what they're doing with their life. So with sleep, how many hours of sleep are you getting? What sort of activities do you do in the bedroom? Are you working in the bedroom? Are you using technology in the bedroom? Are you tired when you go to bed? Those are general questions that I ask. When it comes to nutrition, what'd you have for breakfast is something I often start with, because what they have for breakfast sometimes can lead you into a pattern of just where their day is going to go.